So standardized data in our context is imperative to an electronic medical record. And when we're talking, I guess, an EHR, we're talking about the aggregation or a longitudinal record about a patient or lots of patients and the data that creates that electronic health record. Because we've standardized our data, we're able to predict things much better, whether that's sepsis in a very ill patient. In transitions of care, we're able to do those transitions, or the computer's able to assist in those transitions much more easily because we standardize that data. So what's coming into the ICU or coming into the ER or even coming into the physician's office, that data all means the same thing to the computer, and therefore it can be of assistance and can be relied upon. Using the HDD, the 3M products that we've been involved with for a long time, we're able to take that data, standardize it, normalize it, and have the computer do a lot of the work versus individuals. And as you know, with clinicians, time's precious. Interoperability has been defined as interfacing between information systems for an awful long time, and that is not interoperability. Interoperability is allowing computers to work with computers without the human filter required, whether that's for decision making or data aggregation or whatever you're going to do. So with the HDD, because we're able to standardize this data, we interoperate at the data level. So what's happening in the lab system is relevant to what's happening at that moment to the patient with all the other pieces of data, whether that's radiological data, whether that's assessment data from a nurse, whether that's coming out of a pump. All that data is important to be used at the time of care. And it is through the HDD we're able to get that into a model, into a standardized model that allows the system to be far more effective and helpful to the patient and to the clinician themselves. So it's very relevant. So what you have are these automated systems that bring a lot of data together, but then it becomes very difficult to use that data to get the real value that these EHRs can provide. So I think what we're missing, and no focus on any specific vendor, because I think that all of the vendors, including us that build our own, share in the same problem. But without getting to some of these standards, we will not achieve the community benefits, whether that's population health or even the individual benefits that we talked about earlier about the clinical information system. So we rushed to functionality, we rushed to gather data, but we didn't spend enough time in getting that data in something absolutely consumable by the computer and just allowing almost ubiquitous interoperability. We've understood the value of being able to do best practice care, to provide protocol-driven care, and we understand what it takes for a computer to do that. So I don't spend a lot of time educating the CFO on the expense that we have as we normalize our data or as we put it into common structures. They get it. We are performing some of the best care in the world, and we're doing it at some of the lowest costs in the world. And although that isn't uniquely an information system things, without the HDD, without the way we structure our data, there is no possible way Intermountain achieves those tremendous benefits. Look at the challenges meaningful use has brought to the table. And again, the challenge has been interoperability. It hasn't been 400-bed hospital putting an EHR in and getting their clinicians to use it. That's hard, but that's not impossible, and a lot of people have been able to do it. However, when that 400-bed hospital needs to talk to 16 different clinics, and those clinics don't share the same system, interoperability becomes a tremendous challenge. And the longitudinal nature of what we're trying to do becomes even a bigger challenge. You want that data in a format, in a way that you can use it across the care process for that particular patient. Interoperability truly can only be accomplished when data is standardized. And the HDD is the platform we've used, and it's the platform that we see other organizations, national organizations, starting to migrate toward to say this will be our standard for how we're going to normalize and standardize our data. And for us, that's tremendously exciting. The reason Intermountain has this tremendous focus on clinical information systems is because we know it saves lives, we know it saves money, and we know how it's done. And it's done through data. And so I'm so grateful there are companies like 3M that are out there focusing on data. And they're focusing on it the right way. And again, I believe the industry And we know the industry is beginning to take notice. And as that standard, as that ability to standardize the data gets greater and greater, the richness of the care we can provide at Intermountain Healthcare, or the care they can provide in Shanghai, China, will all be able to be better. This is one of the situations, if you can get this right, the standardization of our data, all ships rise.